Namaskar, I'm Dr. Indu Biswal. I'm working as consultant microbiology in Bagchi Shankara Cancer Hospital and Research Center. We have a state-of-the-art lab facility and where we perform microbiology in our day-to-day life. So in microbiology, we have automated blood culture systems and bacterial identification systems. So these are latest panels in the market which help in early identification of the bacterial pathogens. So it helps our cancer patients get immediate and valid report. Apart from that, we have an infectious molecular lab where we diagnose rare bacterial and viral infections, which as we know, our cancer patients are immunocompromised patients, so they need these reports early. So we try to our best to give them early and valid report as soon as possible. We also have serological assays. We do dengue, malaria, etc. All the common infections, common serological infections we diagnose in our lab. Apart from that, we also have a fungal mycology lab where we focus on diagnosing rare and common mycological fungal infections which affect our cancer patients. We also have GeneXpert, which helps in early diagnosis of tuberculosis in our patients, and we try to do our best to give affordable and valid as well as accurate reports to our patients. Thank you.